everyone, welcome to our briefing. Our first presenter today is Lisa Barnard. Lisa is a senior health analyst for WorldAware based in Cape Town, South Africa. She obtained her doctoral degree in biochemistry from Stellenbosch University, where her research and discoveries contributed significant develops in the field of endocrinology. Lisa is going to talk about the COVID-19 vaccine rollout and some of the challenges associated with distribution. Lisa?
Thank you, Mary. So as Mary has just introduced me, I'm Lisa Barnard, and we'll be talking about how the vaccine distribution is going. So as of today, the coronavirus disease or COVID-19 pandemic has reached more than 100 million cases globally, with more than 2.1 million related deaths. I'm sure you are all aware of how this has affected not only business and travel continuity, as Maxwell discussed just now, but also our everyday life. We have become adept to ever-changing COVID-19 related restrictions and recommendations. By the end of 2020, the development of an effective vaccine brought some hope to otherwise dire prospects. With the wide-scale distribution of an effective vaccine, the hope is to return to some sense of normalcy and resume normal business operation and travel. As several countries across the globe has now started vaccine injections, we can re-evaluate the road to the end of the pandemic and the hurdles that we still need to overcome to make this a reality. So data from January 25th shows that more than 64 million vaccine doses has been administered. Despite the UK being the first country to authorize vaccine use, Israel has been the most successful in their vaccine rollout program and have vaccinated the most people per capita, 42 people for every 100,000 population, while the United States has delivered the highest amount of vaccine doses, more than 20 million. However, globally, only one vaccine has been administered for every 100,000 population. For a population to have herd immunity against COVID-19, it is calculated that this number should likely be roughly 80,000, meaning that 80% or 80,000 people per 100,000 population should be immunized, and this is unlikely to happen before the end of 2021. In fact, if we looked at the current vaccine landscape, the WHO has only approved the Pfizer vaccine for emergency use, although at least 14 other vaccines are in the process of seeking approval. Wealthier nations that made advanced market commitments were the first to start vaccine rollout with approval from local regulatory councils. This greatly neglects low and middle income countries, since without domestic production or universal approval, other countries aren't able to compete for the vaccine supply. And if you look at the map, this is quite evident. Vaccine distribution is concentrated to Europe and the Americas, while vaccine rollout haven't started within the African continent. However, COVAX, a global organization committed to fair and equitable distribution of COVID-19 vaccines in partnership with 119 countries, has agreements in place to access nearly 2 billion vaccine doses. Of these, they will distribute 1.3 billion doses to 92 low-income economies, hoping to vaccinate 20% of these countries' population by the end of 2021. And they are hoping to start with this rollout by the end of the first quarter of this year. To place this into perspective, this is only about a quarter of the vaccine coverage needed to reach herd immunity. It has now been over a month since vaccine distribution first started, and logistical challenges has come to light. The most prominent likely keeping the cold chain intact. The three most prominent vaccines, Pfizer, Moderna, and AstraZeneca, all have to be kept cold to remain viable, with the Pfizer vaccine requiring minus 70 degrees Celsius or minus 94 degrees Fahrenheit for storage. This requires expensive equipment and has been a challenge even in first world countries. This led to vaccine doses being administered to people without appointment and to non-priority groups, or in worst case scenarios, even going to waste. When vaccine rollouts start in third world countries, this challenge will likely be even greater, especially if we consider that most vaccines will only be viable for 6 hours after it has defrosted. Countries with poor health infrastructure, experiencing ongoing conflict, or countries with geographical challenges in accessing remote populations will have trouble maintaining the cold chain. Furthermore, vaccine rollout has been laid off on local state governments that were in most cases underprepared to handle such a large logistical undertaking. Data on vaccine distribution should therefore be interpreted with caution. At this stage, it's also important to keep in mind that to gain immunity, 2 or more doses of the vaccine may be necessary, placing further strain on supply chains. Therefore, despite the fact that more than 64 million doses has been administered, this doesn't mean that 64 people are immunized. In fact, the available data suggests that the number of people that have received both doses of the vaccine and are in fact immunized is closer to 6 million. This has in fact been one of the major hurdles in the vaccine rollout process, and several vaccine appointments had to be cancelled to ensure that they have enough doses to finish the second much needed dose within the appropriate time frame. To help overcome these challenges, large companies with experience in large logistical undertakings has now partnered with state governments to ensure a more efficient and timelier rollout. Finally, a major hurdle is the identification of several mutant strains that have been identified all over the globe, especially since the available data suggests that these strains are more transmissible and might even be more deadlier. And the burning question therefore remains whether or not the current vaccines will be effective against future mutant strains. It is unlikely that sufficient percentages of most of the population will be successfully vaccinated by 2022. Without sufficient vaccine coverage, further lockdowns and movement restrictions are likely. When we will reach optimal vaccine coverage will be largely dependent on the scaling up of manufacturing, the effective distribution of vaccines while keeping the cold chain intact, and further approval of additional vaccine candidates. With surges in cases as seen over the December holiday season, additional mutant strains will become more common, possibly hampering the progress we've made thus far. It is important to keep in mind that vaccines are only the next phase of our pandemic response. And for the foreseeable future, our first line of defense should not be forgotten. Basic health precautions are still the best way to slow the spread of the disease, and continued vigilance is needed to ensure our safety until optimal vaccine coverage is achieved. Thanks.
Thanks, Lisa. Our next speaker is Max Lightshoe. Max is a senior transportation analyst at WorldAware and is the lead author of WorldAware's quarterly airline safety newsletter. Max holds an advanced degree from Georgetown University's School of Foreign Service, and Max is going to discuss important factors impacting travel resumption in 2021. Max?
All right, and thank you for that introduction. We're going to have a quick talk today about what we expect the global airline industry to look like in 2021. We're going to look at 3 key issues. First, what air travel looked like while the COVID-19 pandemic continues to rage around the world. Second, what things will look like as that pandemic hopefully recedes as the global vaccination campaign gains traction. Finally, we'll look at the safety implications of the pandemic and the upcoming return to service. The COVID-19 pandemic still ongoing, the airline industry is in what I call the sawtooth phase of the recovery, where a chart of passenger numbers and flight availability is a jagged line, with periods of growth, followed by periods of cutbacks, followed by renewed growth, and so on. You can see that trend in the graph on the slide of flight counts in Europe through the pandemic. Right now, the industry is definitely in one of those periods where the line's sloping down, as concerns about the new variants of the virus behind COVID-19 and associated new travel restrictions have led to big cuts in flights, especially in Europe. I expect those cuts to continue for the next few weeks as health authorities figure out the true threat of these new virus mutations and the airlines figure out how to cope with the new travel restrictions. We saw in the early parts of last year that passenger numbers and flight availability dropped to their lowest during the initial panic phases of the COVID-19 outbreak and then slowly recovered as governments and travelers learned to live and do business while the pandemic was still going on. Even if the actual public health situation doesn't improve, I still expect that traveler numbers and flight availability will eventually creep upwards as travelers get more comfortable with the situation. But as I said, any recovery in the airline industry while the pandemic is still raging is subject to rapid setbacks. Real recovery won't come until a vaccine is widely available to the general public in the main countries that drive the global economy. As Lise just said, there's still a lot of uncertainty about when that time will come. But whenever it does come, I expect the airline industry to recover quickly and create a very traveler-friendly environment with high flight availability and very low fares, especially for business travelers. To understand what is likely to happen to air travel after the pandemic recedes, it's useful to look at countries and regions where COVID-19 activity has already been brought under control, at least temporarily. Passenger numbers and flight availability in these areas have recovered very quickly, often defying analysts who said it would take years for passenger numbers to recover to 2019 levels. The most notable of these cases has been China, where domestic passenger numbers at the end of 2020 were actually above where they were at the end of 2019, despite airlines losing most of their connecting traffic from international flights. Airlines in Europe also experienced faster than expected recovery during the brief lull in the pandemic over the summer of 2020. A common feature of these recoveries was that airlines used ultra-low fares and other incentives to stimulate demand, especially among leisure travelers. Airlines have already indicated that they plan to use those same tactics once the pandemic recedes. Leisure traveler recovered faster than business travel in those markets, and if that trend repeats itself, it will benefit low-cost carriers that are primarily focused on leisure travelers. But that leisure traffic tends to be less profitable for airlines than business traffic is. So airlines' main priority after the pandemic recedes will be to get business travelers off of Zoom and back into the habit of traveling. Airlines will likely employ steep discounts, more passenger-friendly policies, and heavy marketing to lure business travelers back into the air. Those incentives, together with incentives from hotels, car rental companies, and other companies in the travel industry, should create a very traveler-friendly environment for at least the first 6 months after a COVID-19 vaccine becomes widely available. So that's the good news. But there's still one big worry with the airline industry's rapid recovery, and that's safety. Airlines are going to be bringing large numbers of aircraft back into service from long-term storage and putting those aircraft in the hands of pilots and mechanics who have been off work or working reduced hours for over a year, all while most of those airlines face major financial challenges. All those factors together are going to put stress on airline safety standards. Airlines with strong safety cultures should be able to deal with those issues in a way that doesn't threaten passenger safety. Those airlines will take the time to properly inspect and test aircraft being brought back from storage. They have enough redundancy and oversight in their cockpit and maintenance procedures to ensure that they can catch and correct any mistakes from a sluggish, out-of-practice pilot or mechanic. And those airlines aren't going to cut corners on safety issues to save money, even under financial stress. However, airlines with lesser safety cultures might allow their safety standards to slip under this sort of pressure. We've already seen major airliner disasters in Pakistan and Indonesia since the start of the pandemic, and both those disasters involved carriers that WorldAware have listed as not preferred in our World Airline Monitor due to concerns about those airline safety standards. Now, we don't know the reason for the crash in Indonesia yet, but the crash in Pakistan appears to have been caused by a series of major errors by pilots at an airline that had just resumed flying after a pandemic-induced shutdown. So while it's always important for travelers to ensure they're flying on airlines with appropriate safety standards, it will become even more important in that first year after the COVID-19 pandemic recedes.